Hello everyone. So I got my glasses back and we will be talking about the cardiovascular exam, which is a very important examination for students and practitioners alike. And so just excuse me, let me get a little bit sip of this. Just keep my energy up. Yes, so the cardiovascular exam is very important, and like I said in our previous videos, we would give you a script for as many examinations as possible from head to toe. Now, with that said, remember, I'll tax you to go back and watch my other videos where I addressed WIPA and IPPA. The cardiovascular exam is probably one of the examinations where you probably would need all of the synopsis to deliver. Now, with that said, the script for these examination is hands, elbows, neck, eyes, mouth, chest, and water. So I'll take it again: hands, elbow, neck, eyes, mouth, chest, and water. Now, with that said, some students like maybe an alphabetical sort of way of remembering. So that's hen, nim, chew. And that spells out as HENEM, C in capital, H and E in small letters, and W in capital letters. So how does this translate? So what you want to do is you want to start your examination by inspecting and palpating the hands. So in the hands, you want to use my technique of palmar. You want to look at palmar opposite. So there are many videos and texts deal with what to look at. I'll just mention a few of them. So you want to look at, for instance, changes in the palm, Osler nodes. You want Janeway lesions, splinter hemorrhages. You want to look at pulse. You want to feel pulse. You want to look for pallor, paleness. You want to look for temperature. There are a few things that you can look at in the hands that relates to cardiovascular disease. Then you want to go to elbow, precisely feeling for the pulse. Now, once you've done that, you want to go to the neck and feel for the carotid pulse, and the jugular venous pressure needs to be calculated. And then there are videos that deal with the technique of calculating this. Once you've done that, you want to also assess the hepatojugular reflex at the same time. So once you've dealt with the neck, you want to look at the eyes for things like cornea, arcos, zalantesma, anything that relates to cardiovascular disease. And you also want to look at pallor. Once you've done that, you want to go to the mouth and look for evidence of pallor and cyanosis as well, and examine for that. And then you want to go to the elephant in the room, which is the chest. So you want to inspect, palpate the chest, precisely the precordium. You want to inspect it. You want to palpate for the apex beat, its location, and things like that. You also want to auscultate. There's not a lot of use of percussion like you would have learned in the chest, but there is limited use of percussion in things like cardiac tamponade. Like I said, the aim of our videos is to teach you the script rather than the technique, because the technique has been, well exhausted by several videos on YouTube, excellent text. In addition, just to add, in pulse, you want to talk about the collapsing pulse, or what some books call the Corrigan's pulse. Then finally, you want to talk about water. So you want to check for edema behind, in the back, in the sacral area, and of course in the lower limb. So usually this would conclude the cardiovascular exam in an OSCE. And then you want to thank the patient for cooperating and being polite to them and respectful. And then you want to summarize, like I said in my previous videos, using S-bar. And I'm going to task you to go to my other videos and learn what S-bar means. That's S-B-A-R. Once you've done that, you want to summarize your findings and present it to the examiner. Now let's do a recap. So in a cardiovascular exam, so wiper, you would start with wiper, and it also follows the typical sequence of IPPA. Percussion, probably not a lot, but in trauma patients with cardiac tamponade, you probably will find it useful. Also, in all the causes of cardiac tamponade, percussion does have a role. Now, with that said, the script is hands, elbow, neck, eyes, mouth, chest, water. Some students want the alphabetic version is Henem Chew, and that's H-E-N-E-M, capital letter C, small letter H-E, and then capital letter W. So this summarizes the examination of the cardiovascular system script-wise. And thank you for watching. Please like and subscribe the Academy. I would be introducing other guest teachers, my friends from. So I'm going to be introducing a friend of mine who is a GP doctor. He'll be joining to deliver something on feedback, Pendleton's and Aloba's feedback. I would also be introducing again a very good expert content creator who is a children's doctor in London, and also another one who is a skin doctor, dermatologist in Coventry. So stay with us. We have more content coming your way. Thank you for watching.